ACE personal trainer test, client interviews and assessments 146 questions. Question 1. Bill is a 50-year-old man with a family history of heart disease. His body mass index is 20 and he has been running 3 miles 3-4 days a week for a year. What are the exercise testing recommendations according to risk stratification based on his cardiovascular disease risk factors? A. Moderate risk, medical exam necessary before vigorous exercise. B. Modify the program with cross-training. C. Talk with his doctor about his readiness for exercise. D. Low risk, medical exam not necessary. Question 1 Answer: A. Moderate risk, medical exam necessary before vigorous exercise. Question 2. The area beneath your feet that includes all points of contact. A. Base of support. B. Range of motion. C. Motor unit. D. Inversion. Question 2 Answer: A. Base of support. Question 3. The short band of fibrous tissue that holds a joint together by connects two bones. A. Obliques. B. Tendon. C. Sciatica. D. Ligament. Question 3 Answer: D. Ligament. Question 4. Lying on your back while in a face-up position. A. Power. B. Supine. C. Tinnitus. D. Sprain. Question 4 Answer: B. Supine. Question 5. An imaginary horizontal line that divides the body between upper and lower sections. Also referred to as the horizontal plane. A. Testosterone. B. Anterior. C. Transverse plane. D. Sagittal plane. Question 5 Answer: C. Transverse plane. Question 6. The way a person moves on foot in sequence such as walking, running, stepping, etc. A. Syncope. B. +3. C. Fascia. D. Gait. Question 6 Answer: D. Gait. Question 7. What 3 sites are suggested for skinfold measurement in women? A. Vestibular system. B. Triceps, thigh and suprailium. C. Investigation stage. D. Chest, thigh and abdominal. Question 7 Answer: B. Triceps, thigh and suprailium. Question 8. Your new client informs you that she has diabetes and is taking insulin. What is the most important thing to do for this client? A. High risk, medical exam before moderate exercise. B. Talk with his doctor about his readiness for exercise. C. Talk with her doctor about her readiness for exercise. D. Refer her to a physician prior to beginning an exercise program. Question 8 Answer: D. Refer her to a physician prior to beginning an exercise program. Question 9. When answering the Physical Activity Readiness Questionnaire, PARQ, your client answers yes to chest pain during physical activity as well as currently taking a prescription blood pressure medication. What is the next step in his fitness program? A. High risk, medical exam before moderate exercise. B. Slow twitch muscle fiber. C. Heart rate reserve. D. Talk with his doctor about his readiness for exercise. Question 9 Answer: D. Talk with his doctor about his readiness for exercise. Question 10. A ratio which compares the total amount lifted versus a person's body weight is measured in a ratio. It allows for comparative strength measurements across different individuals. A. Relative strength. B. Radial artery. C. Extension. D. Talk test. Question 10 Answer: A. Relative strength. Question 11. When the body has an elevated level of ketone bodies in their tissues, typically the result of a low-carbohydrate or starvation-style diet. A. Power. B. Strain. C. Ketosis. D. Kyphosis. Question 11. Answer: C. Ketosis. Question 12. A muscle action where the muscle lengthens against resistance. It is also commonly referred to as negative work. A. Eccentric. B. Strain. C. Isotonic. D. Concentric. Question 12. Answer: A. Eccentric. Question 13. When a muscle acts specifically to produce a desired movement, commonly referred to as an agonist. A. Prime mover. B. Anterior. C. Posterior. D. Stroke volume. Question 13. Answer: A. Prime mover. Question 14. Movement of a limb toward the midline or middle axis of your body. A. Preparation. B. Sprain. C. Extension. D. Adduction. Question 14. Answer: D. Adduction. Question 15. Your client is complaining of pain with extension of her elbow. She has a history of lateral epicondylitis, tennis elbow. What is the best course of action to take in continuing her exercise program? A. Investigation stage. B. At the level of the umbilicus. C. Modify the program with cross-training. D. Evidence of disclosure. Question 15. Answer: C. Modify the program with cross-training. Question 16. Kristen is in for her second session and you are conducting fitness assessments. While you are checking her body fat percentage, you ask her about types of exercise she prefers to do. What stage of the client-trainer relationship are you in with Kristen? A. Vasodilation. B. Investigation stage. C. Inversion. D. Static posture. Question 16. Answer: B. Investigation stage. Question 17. A ratio used to determine health concerns from weight distribution. Measured by girth calculations at the waist and hip. A. Axis of rotation. B. Vasoconstriction. C. Base of support. D. Waist to hip ratio. Question 17. Answer: D. Waist to hip ratio. Question 18. A steroid hormone produced in the testes and responsible for the growth and development of male sexual characteristics. A. Testosterone. B. Extension. C. Tendon. D. Isometric. Question 18. Answer: A. Testosterone. Question 19. A fibrous tissue that binds, supports and protects muscles, organs and structures of the body. This includes tendons, ligaments, joint capsules, etc. A. Connective tissue. B. Static posture. C. Concentric. D. Co-contraction. Question 19. Answer: A. Connective tissue. Question 20. When performing a static postural assessment on your client, you determine that your client has a slight posterior pelvic tilt. This means that the line of symmetry is _ A. Inversion. B. Tilted posteriorly. C. Anterior. D. Static posture. Question 20. Answer: B. Tilted posteriorly. Question 21. Decreases in blood pressure due to the dilation of blood vessels. A. Abduction. B. Vasoconstriction. C. Adduction. D. Vasodilation. Question 21. Answer: D. Vasodilation. Question 22. A movement that flexes the foot in an upward direction from the ankle. A. Mobility. B. Dorsiflexion. C. Sprain. D. Inversion. Question 22. Answer B. Dorsiflexion. Question 23. A movement of the body away from the midline, turning outward. A. External rotation. B. Precontemplation. C. Vacillation. D. Axis of rotation. Question 23. Answer A. External rotation. Question 24. Measures the mineral density in your bone. Indicates bone strength through calcium content. A. Bone mineral density. B. Molar unit. C. Once every minute. D. Connective tissue. Question 24. Answer A. Bone mineral density. Question 25. A condition that develops in adulthood and is also referred to as non-insulin dependent diabetes. The body is unable to use insulin properly and is often seen in those who are overweight or obese. A. Raised heels. B. Medial. C. Kyphosis. D. Type 2 diabetes. Question 25. Answer D. Type 2 diabetes. Question 26. Which term describes muscle action which shortens to create muscle tension? A. Isometric. B. Isokinetic. C. Visceral. D. Concentric. Question 26. Answer D. Concentric. Question 27. Refers to the intensity of exercise where lactate accumulates into the bloodstream. Lactate concentrations rise above resting levels. A. Heat stroke. B. Talk test. C. Lactate threshold. D. Heart rate reserve. Question 27. Answer C. Lactate threshold. Question 28. A muscular contraction in which the joint angle and muscle length doesn't change. A. Eccentric. B. Isometric. C. Concentric. D. Isokinetic. Question 28. Answer B. Isometric. Question 29. What component of fitness does the push-up test measure? A. Insulin resistant. B. Muscular power. C. Molar unit. D. Muscular endurance. Question 29. Answer D. Muscular endurance. Question 30. In what specific location is the circumference of the upper thigh measured? A. Just below the gluteal fold. B. At the level of the umbilicus. C. Precontemplation. D. Lactate threshold. Question 30. Answer A. Just below the gluteal fold. Question 31. How often should ratings of perceived exertion, RPEs, be taken throughout a cardiorespiratory assessment? A. Once every minute. B. Stroke volume. C. Concentric. D. Knees moving inward. Question 31. Answer A. Once every minute. Question 32. The fatty tissue that lies beneath the surface of skin. A. Molar unit. B. Muscular power. C. Contusion. D. Subcutaneous fat. Question 32. Answer D. Subcutaneous fat. Question 33. A stretching or tearing that occurs from a traumatic twist causing pain and swelling. Usually involves ligaments or joint capsules. A. Tendon. B. Sprain. C. Syncope. D. Fascia. Question 33. Answer B. Sprain. Question 34. In which stage of the trans-theoretical model of behavior change, TTM, is a client ready to adopt and live a healthy lifestyle? A. Sprain. B. Abduction. C. Preparation. D. Vasodilation. Question 34. Answer C. Preparation. Question 35 refers to the front side of the body or nearer the head. A. Abduction. B. Inversion. C. Anterior. D. Contusion. Question 35. Answer C. Anterior. Question 36. A muscular contraction in which joint movement occurs and muscle tension is created. A. Isokinetic. B. Isometric. C. Isotonic. D. Insertion. Question 36. Answer C. Isotonic. Question 37 describes the constriction of blood vessels by the small muscle walls. A. Vasoconstriction. B. Isotonic. C. Eccentric. D. Insertion. Question 37. Answer A. Vasoconstriction. Question 38. The simple sugar that represents the form in which all carbohydrates are used as a primary energy source by the body. A. Glucose. B. Syncope. C. Supine. D. Ketosis. Question 38. Answer A. Glucose. Question 39. A muscle tear, stretch, or injury caused by overexertion can affect the muscle, tendon or fascia. A. Atrophy. B. Ketosis. C. Sprain. D. Strain. Question 39. Answer D. Strain. Question 40. Mark is a 32-year-old man. What is his estimated maximum heart rate? A. Distal. B. Ketosis. C. Supine. D. 188 bpm. Question 40. Answer D. 188 bpm. Question 41. Excessive curvature of the spine which causes hunching of the back. A. Isotonic. B. Kyphosis. C. Syncope. D. Dyspnea. Question 41. Answer B. Kyphosis. Question 42. The ability of the body to remain balanced between its base of support and weight distribution. A. Sagittal plane. B. Frontal plane. C. Static balance. D. Static posture. Question 42. Answer C. Static balance. Question 43. Waist measurement divided by hip measurement. A. Detailed medical and health information. B. Waist to hip ratio. C. Modify the program with cross-training. D. How do you determine a person's waist to hip ratio? Question 43. Answer D. How do you determine a person's waist to hip ratio? Question 44. Wendy is a 50-year-old woman who has not exercised in 3 years. She has no family history of heart disease and is a non-smoker. What are the exercise testing recommendations according to risk stratification based on her cardiovascular disease risk factors? A. Delayed onset muscle soreness. B. Radial artery. C. Low risk, medical exam not necessary. D. High risk, medical exam before moderate exercise. Question 44. Answer C. Low risk, medical exam not necessary. Question 45. Muscle fibers that contract rapidly with low oxidative capacities. Also called type 2 fibers. A. Heart rate reserve. B. Fast twitch muscle fiber. C. Static posture. D. Static balance. Question 45. Answer B. Fast twitch muscle fiber. Question 46. The maximal oxygen uptake the body can use during a specified time frame. Measures cardiovascular endurance through 1 minute per kilogram of body weight. Also referred to as maximum aerobic capacity. A. Visceral. B. VO2 max. C. Ligament. D. Power. Question 46. Answer, B. VO2 max. Question 47. What are the correct units of measurement for calculating body mass index, BMI? A. Talk test. B. Weight, kg/height, m. C. Relative strength. D. Ligament. Question 47. Answer, B. Weight, kg/height, m. Question 48. What is considered the easiest method for assessing a client's exercise intensity? A. Gait. B. Talk test. C. Glycogen. D. Ketosis. Question 48. Answer, B. Talk test. Question 49. The amount of energy needed to maintain the basic functions of living. A. Isotonic. B. Isometric. C. Elasticity. D. Basal metabolic rate. Question 49. Answer, D. Basal metabolic rate. Question 50. An action which happens in the frontal plane and represents the inward rotation of the foot. A. Hypertension. B. Contusion. C. Inversion. D. Extension. Question 50. Answer, C. Inversion. Question 51. Inflammation of the bristle which is located between bones, tendons, joints and muscles. Most typical areas affected are the hip, shoulders and elbow. A. Tinnitus. B. Fascia. C. Tendinitis. D. Bursitis. Question 51. Answer, D. Bursitis. Question 52. Compression of the sciatic nerve which causes pain to shoot down the leg. Often they result from a lumbar herniated disc. A. Sprain. B. Distal. C. Eccentric. D. Sciatica. Question 52. Answer, D. Sciatica. Question 53. What blood pressure measurement is considered to be a risk factor for cardiovascular disease? A. 165 bpm. B. 202 bpm. C. 149th millimeter of mercury. D. Ligament. Question 53. Answer, C. 149th millimeter of mercury. Question 54. Excessive inward curvature of the spine in the lower region. A. Contusion. B. Atrophy. C. Lordosis. D. Kyphosis. Question 54. Answer, C. Lordosis. Question 55. The amount of blood pumped from the left ventricle during each contraction of the heart. A. Stroke volume. B. Prime mover. C. Static balance. D. Testosterone. Question 55. Answer, A. Stroke volume. Question 56. In what stage of the client-trainer relationship are health history and lifestyle questionnaires administered? A. Investigation stage. B. Vestibular system. C. Static posture. D. Sciatica. Question 56. Answer, A. Investigation stage. Question 57. Describes muscle pain and soreness that typically occurs within 24 to 48 hours following strenuous exercise. It can result in restricted range of motion, tenderness and muscle weakness for a short period. A. Delayed onset muscle soreness. B. Tilted posteriorly. C. Pre-contemplation. D. Testosterone. Question 57. Answer, A. Delayed onset muscle soreness. Question 58. A manual massage-like treatment designed to release tension in the fascia. A. Plantar flexion. B. Myofascial release. C. Muscular power. D. Static posture. Question 58. Answer B. Myofascial release. Question 59. In what specific location is the abdominal circumference measured? A. At the level of the umbilicus. B. Range of motion. C. Tilted posteriorly. D. Lateral epicondylitis. Question 59. Answer A. At the level of the umbilicus. Question 60. Peter is a 47-year-old male with a BMI of 31. He has been leading a sedentary lifestyle until recently hiring you. What is his risk stratification? A. +3. B. Distal. C. Sprain. D. Supine. Question 60. Answer A. +3. Question 61. A condition where the pancreas produces little to no insulin. It usually develops in childhood and is also referred to as juvenile diabetes or insulin-dependent diabetes. A. Rapport stage. B. Type 1 diabetes. C. Obliques. D. Ketosis. Question 61. Answer B. Type 1 diabetes. Question 62. A heart rate with a faster beat than normal, measured at over 100 beats per minute. A. Anterior. B. Tachycardia. C. Tendinitis. D. Medial. Question 62. Answer B. Tachycardia. Question 63. You have a new client who is extremely obese, and you realize that your body fat calipers, skin fold measurement, may not be an accurate method to determine their body fat percentage. You want to have a starting measurement to determine their progress. What is the best course of action? A. Utilize body mass index, BMI, and girth measurements. B. Static postural assessments. C. Rectus abdominis and hamstrings. D. Detailed medical and health information. Question 63. Answer A. Utilize body mass index, BMI, and girth measurements. Question 64. An extension of a part of the body beyond the normal range of motion. A. Hypertension. B. Preparation. C. Inversion. D. Hyperextension. Question 64. Answer D. Hyperextension. Question 65. When answering the Physical Activity Readiness Questionnaire, PARQ, your client answers yes to a bone or joint problem that could be made worse by a change in physical activity. What is the next step in his fitness program? A. At the level of the umbilicus. B. Evidence of disclosure. C. Previous exercise including adherence experience. D. Talk with her doctor about her readiness for exercise. Question 65. Answer D. Talk with her doctor about her readiness for exercise. Question 66. High blood pressure that exceeds the average and recorded as resting blood pressure at or above 140/90 mm of mercury. A. Posterior. B. Hypertension. C. Ketosis. D. Sprain. Question 66. Answer B. Hypertension. Question 67. An imaginary vertical line that divides the body between front and back sections. Also referred to as the vertical plane. A. Rapport stage. B. Sagittal plane. C. Frontal plane. D. Static balance. Question 67. Answer C. Frontal plane. Question 68. Injured tissues or skin where blood capillaries may have broken but the skin is not. Similar to a bruise. A. Posterior. B. Tendon. C. Contusion. D. Lordosis. Question 68. Answer C. Contusion. Question 69. What is the best definition of VO2 max? A. Midway between the acromion and the olecranon process with the arm relaxed. B. Maximum amount of oxygen a person can utilize in 1 minute per kg of body weight. C. Modify the program with cross-training. D. Oxygen consumption at rest. Question 69. Answer B. Maximum amount of oxygen a person can utilize in 1 minute per kg of body weight. Question 70. A decrease in muscle size and functional ability as a result of inactivity or lack of use. A. Atrophy. B. Syncope. C. 12 BPM. D. Power. Question 70. Answer A. Atrophy. Question 71. In what specific location should the arm be measured? A. Hip flexors and erector spinae. B. Midway between the acromion and the olecranon process with the arm relaxed. C. High risk, medical exam before moderate exercise. D. After reaching the first ventilatory threshold. Question 71. Answer B. Midway between the acromion and the olecranon process with the arm relaxed. Question 72. Tight hip adductors and weak gluteus medius muscles can lead to which compensation? A. Ischemic. B. Knees moving inward. C. Sciatica. D. Once every minute. Question 72. Answer B. Knees moving inward. Question 73. A muscular contraction in which the muscle changes throughout the range of motion, also commonly called variable resistance. A. Concentric. B. Ischemic. C. Eccentric. D. Tendinous. Question 73. Answer B. Ischemic. Question 74. Any physical condition that makes a movement or exercise inadvisable or inappropriate. A. Adduction. B. Vacillation. C. Contraindication. D. Co-contraction. Question 74. Answer C. Contraindication. Question 75. What is an example of testing absolute strength? A. Insulin resistant. B. Type 1 diabetes. C. 1 RM leg press test. D. Rapport stage. Question 75. Answer C. 1 RM leg press test. Question 76. A muscle action where the muscle shortens under tension. It is commonly referred to as positive work. A. Concentric. B. Posterior. C. Co-contraction. D. Isotonic. Question 76. Answer A. Concentric. Question 77. What information does the informed consent form collect? A. Insertion. B. Inversion. C. Evidence of disclosure. D. Static posture. Question 77. Answer C. Evidence of disclosure. Question 78. What information does the health history questionnaire collect? A. Waist-to-hip ratio. B. Detailed medical and health information. C. At the level of the umbilicus. D. Basal metabolic rate. Question 78. Answer B. Detailed medical and health information.